Ladies and gentlemen, please, I have 5 minutes presentation that will be done by Dr. Uche Ajani, our consultant for Fountain of Joy. Thank you.
Good evening, everybody. On behalf of Fountain of Joy and Comfort, I just want to give you a preview of some of the activities that we do. That's my name up there. Nigeria is one little place in Africa. Basically, we cater for the poor pregnant women, children who do not have funds to go to school, and then we render free eye services to those in the communities that are yet to be reached. We are legally registered in Nigeria with the Corporate Affairs, and that is the certificate for the foundation. Fountain of Joy and Comfort is not a name that any of us coined, but the president and the founder, Mr. Paul Odili, had a divine revelation from God asking him to give help, bring joy, bring comfort to those who needed it in a dream. And Fountain of Joy and Comfort, the name was given to him directly in that divine revelation. And all we're doing is living it. Basically, we started this foundation in 2011. And like I said, it's mainly to provide medical provision to the pregnant, poor women, education, and free eye services. These are the members of staff of Fountain of Joy and Comfort. It comprises ophthalmologists, optometrists, ophthalmic nurses, anesthetists, and lab scientists. Our services include free eye services, and we target to reduce preventable causes of blindness, restore sight through medical outreach programs, establish a first-class eye hospital, and mobile clinics that are fully equipped for community service delivery. The maternal health care for poor pregnant women, we aim to reduce infant mortality and increase life expectancy, ensuring availability and affordability of good maternal health care services. The standard education and scholarship for poor children who cannot afford to go to school is something that the foundation does to bring empowerment to the children in our society. This may sound a bit odd to most of you seated here because you have the facilities, you have the provision by the government of your countries to cater for those that are indigent. But this is not a so common occurrence in Africa and Nigeria in particular. Funding of the activities of Fountain of Joy and Comfort comes from Polo Communications, Polo Group of Companies, which comprises communications, oil and gas, real estate. So the profit from this group of companies is plugged back into the Fountain of Joy and Comfort to be able to provide these facilities for the indigent in our own country. We've had a couple of outreaches, and from January 2012, when we took off, we've been able to cover 3 communities within 2 states in Nigeria. We've seen a total of 4,496 people. 3,531 were issued glasses. Our people cannot even afford to pay for glasses for themselves. Reading glasses, glasses for sight correction, they can't afford it, but the foundation provides us. When we go out for medical outreach, we don't just look at the eyes, we look at the person we have in front of us. So part of the things we do, we screen for the common communicable diseases, hypertension, non-communicable diseases, hypertension and diabetes, and we do that for those who are over 40 years, those who are probably more predisposed to it than the younger population. And we found out that 1,126 were hypertensive, 302 were diabetics. We initiated treatment in this group of people and referred to the appropriate general hospitals, secondary and tertiary hospitals within the vicinities where we covered. If we pick patients who require surgeries, we do surgeries on the fields. So we're able to operate about 118 patients. 64 of them had cataract surgery, 24 glaucoma, and 28 cataract surgeries. There we are doing the surgeries and examining our patients. At the educational level, the top photograph you see is the school we met in one of the villages. And you could see how dilapidated it is. The children learn outside, no seats. The Fountain of Joy and Comfort was able to build and donate this to that community, the picture in the lower segment, and the classrooms are equipped. We don't just give buildings, we also provide books. And we go that in branded bags containing the books, the Bibles, because it is quite important that we preach the word even as we try to help to meet their social needs. So here we are donating the books to about 4 different communities within Delta State, one of the states in Nigeria. This is a primary healthcare center that was built and donated by Fountain of Joy and Comfort to Togboje community, where Mr. Paul is from. We built, equipped, and the place is manned by a midwife, and she's supported by 7 health attendants. Over 50 babies have been delivered successfully since inception. What are our future programs? We look at having 2 more outreaches to 2 states in Nigeria before the close of the year. We are currently building a tertiary hospital in Utogboje, which is supposed to serve as a referral center for one of the 6 zones in Nigeria, the South-South. We are constructing a secondary school right now in Utogboje so that the indigent, the poor children will be able to have a secondary education. We invite you to partner with us. Partnership in form of donation of books, drugs, equipment, not just to reach 2 states, possibly if we could cover the 36 states of Nigeria. Our website is indicated. Thank you very much.